Okay, thank you, Rich. I'm going to go ahead and get started with case number 1 today. And this is a pretty typical case that we would see in our clinic. Victor is a 61-year-old Hispanic male who got referred to me for a glaucoma evaluation because he had a big CD ratio. His ocular history is unremarkable and his medical history is fairly unremarkable. He's pre-diabetic, just controlled with diet and exercise, and he has hypothyroid disease for which he takes a thyroid replacement hormone. There's no glaucoma in his family, and his initial findings in his exam were normal. 20/20 vision in each eye, pupils, motility, confrontation fields were normal in each eye. On slit lamp exam, there were no abnormal signs of secondary glaucoma, and his gonioscopy was open to the ciliary body band 360 degrees in both eyes. Intraocular pressure on this first visit were 18 in the right eye and 15 in the left eye. And this is kind of how we go about our glaucoma evaluation. We sort of do things in little silos. So I look at his optic nerves and, I look and I say, okay, I've got very large optic nerves, and that means I should probably expect to have a large CD ratio, which I do. We look at visual fields, and this is his first time to take a visual field, so you can sort of analyze those. And then, of course, we'll get an OCT, and so I've just shared with you his RNFL OCT, and I just wanted to go through it just a little bit. When I first look at this, I say, hey, I've got good quality, my discs are centered well within the measuring circle, and I've got lots of thick colors here. I've got lots of reds and yellows superiorly and inferiorly in both eyes. I notice that all of my disc parameters are grayed out, and that's because his optic nerve is so large he falls outside of the reference zone. And so, everything's looking pretty healthy here. When I look at his RNFL profiles, he is really, really thick. I mean, he's so thick that he's actually exceeding the normative database. And when I come down to the sectors and the quadrants down on the bottom, everything is, again, so thick that he's either green or white, meaning that he's very, very thick here. And so now you've sort of gone through your entire exam, and the question is this glaucoma? And I think if you looked at any one of those 3 items, you might say, I don't know, he looks a little suspicious, but I'm not ready to call it. But one of the things that I use a lot in Forum is something called the structure function plot. And so this allows me to look at all the pieces of data in one screen or in one shot. And it really helps me to try to see if I can find correlation between my exam findings. And so if we look at this structure function plot for Victor, and I'll draw your attention to this middle RNFL T-SNP curve, and we see right away that there's a big difference. Even though both eyes have really thick nerve fiber layer, there's a big difference between the superior nerve fiber layer in the right versus the left eye. We can see that there is, although there are bright colors here, we see that there is a slit defect in the nerve fiber layer, and that correlates very well with this inferior nasal step or partial arcuate visual field defect. And so it's not that we couldn't see any of these things individually, but when we get them all on one page or in one room, instead of being in these little silos, it just becomes much easier to put the whole picture together. Now, on my Forum, I don't have a ZEISS camera, and so Forum will store my optic nerve photos, but it won't recognize them as an optic nerve photo. So I have to look at those separately. But if we go back to Victor's optic nerve photo, if you look really carefully, you can see there's a little tiny disc hemorrhage right at the superior rim, as well as a nerve fiber layer defect. And I think that both of these things are relatively subtle and could be missed on a clinical exam if you were, maybe not on your game that day, or you were busy, or you had patients waiting, or you were distracted. But when we go and we put everything together, it becomes much more obvious that Victor, in fact, does have glaucoma.
Thanks, Danica. That's a great case. Here in Forum, we can view and do so many things with it, and you were able to show in your case, I think, some very informational, or some ways in which the information dovetails well, and you're grabbing different modalities. Forum allows us to kind of do that. And in this particular version of Forum, we've got a series of tools that are at our kind of our fingertips. We've got progression summary. We can go into visual field GPA or progression analysis. We can look and just browse individual fields. We've got the structure function progression analysis that we can use as well. And then the creation of those said reports that we were just looking at. Also in this screen, we're looking at a series of the clinical, sort of not clinical events, but the clinical data and information that we have. We are able to support or kind of sort this by OCTs only. We can look if we just wanted to see where all the fundus images were or additional images on the patient, and then visual fields or any other sort of data. And you even mentioned that a little bit about the case that you had with the unidentified piece of information around an optic nerve photo. And so you'll find or have the capability to find those sorts of things that are here on this right-hand side. And in this particular case, just kind of keeping in with the pace of discussion that we had around this green disease case, I wanted to highlight a few things about this particular individual, this gentleman that we're looking at here, 64-year-old white male. And what you'll see with his case is we do have that capability of just sorting to a single date. So I'm into November 9th or November 5th of 2009, the very first time that we saw this individual in the clinic. And you can see here that same static report where we can do some comparative analysis on this particular individual. In these cases, though, the creation of those reports can happen either in workplaces or it can happen in the actual review of the data and information on the patient. In our particular situation here, we would go into creating reports. And in this report creation module, we can select the different report types that we might want, a structure, function, single exam, go into and actually select the individual date of the visual field that we're looking for. And I'm just here kind of watching me go through this process while selecting the right and the left eye. It's going to ask me what kind of OCT exam I want. So if I've got the same date, I can go in and I can choose that same thing on this individual. It's going to also go in, and if there was a macular cube that was run, and I think this brings up a really interesting point. Macular cubes weren't something that routinely we were running until we saw the value of ganglion cell analysis and the way that it dovetailed with our RNFL analysis. But here now you can see that and the ability to select these things so that those come up in your structure function, and then the fundus images. So you can see kind of how easy I think it is to just go step by step. And in this one, we're using a Claris and ultra wide field. You see two different fundus images. So I could have chosen any number of fundus images there, whether it was the ultra wide field or just the wide field examination. What it's doing here is it's actually taking the information and making sure that it would match or register. And then once all of this data and information are in there, we can go into and we can actually create the report that we were just looking at a moment ago on your screen. So it's really, I think, unique the way that we've got this capability to slide in and out of the data and do analysis for these patients. But in this particular case, I think one of the values as well is what does that look like if we view this case sort of live. And what I mean by live is going back to that structure function GPA. So we saw the reports and the demonstration of the reports in your case, but here is that case now in a full view where we've got our ability to look at the mean deviation that's up in the left-hand side. We've got over to the right your nerve fiber analysis, and this can be customized. We can grab this, and we'll dive into this a little bit more with another case, but all of the data and all of the information we were just looking at, and you can see even where the software is trying to grab other images from other events and assign it. You can eliminate these pieces, and we can kind of walk through that a little bit more, but this is that green glaucoma case where we're looking at those that right and left eye. You can see the initial baseline on the case, and the other eye where there's really nothing going on at all, and do the analysis live with the patient sitting there, or spend a lot of time digesting this case maybe with colleagues, as we do in a 4-doctor group clinic, that we'll spend time and look at this, and it's really useful to have this objective data and information to discuss and digest.
You know, one of the things I like about this, Erin, is that I'm able to just be in one spot. You know, I don't have to run over to my OCT room. I don't have to run over to my visual field room. It's just all on the computer, and it's just, I can look at it in any number of ways. And the thing that you have up here right now, like you have your mean deviation, average nerve fiber layer thickness, RNFL thickness profile, and average ganglion cell interplexiform thickness. But can you drop down, or can you pull one of those down to just show how many different things you can track? Um,
Sure, and so these are, when we pull these drop downs, this applies to not just the information that's in that quadrant, but anything. So I could change this to look at mean deviation and a visual field index, for example. So now that visual field index changes, and I wanted, this could be a preset for me, right? Clinically speaking.
yeah.
I could look at it and say, well, this case, I saw in particular on this case, you know, there seemed to be a lot of decrease that was happening inferiorly, as we can see down here in this optic nerve. So maybe I want to look at the RNFL thickness changes that are just occurring inferiorly and get that calculated rate of change that's happening in this versus that same zone or that same nerve and looking at it superiorly. And we can see that negative 1.6 here, rate of change superiorly, but the inferior rate of change is not quite, it's, you know, maybe about a 40% increase there, but that's a significant identifying factor. And we can go into a ton of those different ones here as well.
Yeah, and I love the fact that, you know, something that you can't see on a typical visual field printout is the mean deviation that's just in the superior hemifield that correlates to that, right? So you can just you know, separate it into what's my overall mean deviation, but also what's happening in the just in the superior or just in the inferior. So I really like the flexibility that you have, and you can preset this. But if you think like, oh, this is a patient where my presets don't really work that well, you can go in and you can really dive down into this data.
Well, and another step, and from just an evaluation perspective, is the ability to do comparisons. You know, routinely what we're relying on, and this I think is a great example within within normal limits type of case, where you're looking at an optic nerve that, yeah, there's small little identifying factors, and that traditional flat printout gives us this green zone. But we share this with patients all the time. We want to be able to tell patients, hey, look, this is what we want to know is your normal. This is you compared to the normal database, a normative database. But what we really want to know is what's happening with you. And what we see is the zone where we might have looked, where we saw previously that against a normative database, they had irregularities here. Their actual problem was lurking in this inferior zone. And we only have that if we've got baseline on that patient to compare it to.
Yeah, and can you go back to just the main screen there, please, for a second, Erin?
Sure.
Just the main menu, like, there you go. This is going to sound sort of silly, but one of my favorite things to do is just to look over at the far right-hand side where it shows like what dates did I do an OCT? What dates did I get photos? What dates did I get visual fields? Because sometimes, you know, you're thinking like, okay, what does this patient do for? And hopefully I've written it well in the plan, but it's really nice to be able to go back and say, oh gosh, you know, I haven't gotten a visual field on this patient in 12 months and they should have had one, you know, 6 months ago or 3 months ago. So this is a really easy, quick way to see, okay, how am I doing? What tests do I need to be doing next? You know, what have I maybe not done in a while that it's time to do at this point?
Yeah, and it's interesting that you bring that up, and I'll leave this kind of as our last clinical pearl on this case, especially in those green cases, right? The surveillance of the patient becomes so critical. So what we've now instituted into our practice is that the techs, when they do chart prep, use Forum as part of their tool in chart prep. Saves them a ton of time. They can see it at a glance. They know what our protocols are for glaucoma, and it's a big win for patient care.
That's great.